In this video, we will show you the step-by-step procedure of repairing an episiotomy wound. The methods employed are recommended by the Royal College of Obstetricians and Gynecologists in their Green Top Guideline entitled Methods and Materials Used in Perineal Repair. The guideline recommends the use of absorbable synthetic material such as polyglycolic acid and polyglactin 910 for repair of perineal trauma. It is associated with less perineal pain, analgesic use, dehiscence, and resuturing. Before we start, the patient and the equipments are prepared. The patient is put in lithotomy position with good lighting to expose the extent of the perineal trauma. The perineal region is cleaned with antiseptic solution and a drape is put on to cover the area, providing a sterile environment. Local anesthesia is administered to the perineum and allowed to work within 2 to 3 minutes. A tampon is inserted into the vagina to stop any excessive bleeding and to expose the apex of the episiotomy wound. An anchor stitch is applied at the apex of the wound and secured with several knots. A loose, continuous, non-locking technique is used to oppose the vaginal tissue down to the fourchette. It is very important to identify the fourchette to ensure good anatomical alignment of the wound and to improve cosmetic results. The deep and superficial muscle layer can be approximated using 3 to 4 continuous stitches down to the end of the wound. From the end of the wound, the perineal skin is sutured using a continuous subcuticular technique up to the fourchette, and a final knot can be inserted at the fourchette. These suturing techniques are associated with less short-term pain compared with the traditional interrupted method. The rationale behind the continuous technique is that stitch tension due to reactionary edema is transferred throughout the whole length of the single knotless suture in comparison to interrupted stitches, which are placed transversely across the wound. Rectal examination is performed after completing the repair to ensure that suture material has not been accidentally inserted through the rectal mucosa. Following completion of the repair, inform the woman regarding the extent of trauma and discuss pain relief, diet, hygiene, and the importance of pelvic floor exercises.